It sat on the kitchen counter for 3 days. You knew what it was. The logo in the top left corner gave it away, your health insurance provider. But you weren't worried. You pay your premiums on autopay. You're covered. You're safe. Finally, you tear it open. You scan past the jargon, past the dates, looking for the number at the bottom. And there it is. The number isn't what it was in December. It hasn't gone up by 5%. It hasn't gone up by 10%. It has doubled. For some of you listening to this right now, that monthly premium just jumped from $180 to $600 overnight. You stare at it. You think, this must be a mistake. Is this inflation? Did I miss a payment? No, you didn't make a mistake. But the American healthcare system just triggered a trapdoor beneath your feet. It's called the healthcare cliff. And on January 1st, 2026, millions of Americans just fell off the edge. Today, we are going to look at exactly why your bank account is about to bleed, the silent expiration date Congress didn't tell you about, and the specific loophole you have left to save yourself from financial ruin. To understand why you are suddenly feeling this pain, we have to go back in time. Not far, just a few years. Do you remember the American Rescue Plan? It sounds like ancient history now, but it was the engine that kept the economy floating during the pandemic. Hidden inside that massive bill was a provision that fundamentally changed how Americans bought health insurance. Before that plan, if you made just a little bit too much money, specifically more than 400% of the poverty line, you got zero help from the government. Nothing. You were on your own. If you were a freelancer making $55,000 a year, too bad. You paid full price. If you were a family of 4 making $110,000, tough luck. Your premium could be higher than your mortgage. But the Rescue Plan, and later the Inflation Reduction Act, changed the math. They established a new rule. No one, absolutely no one, should pay more than 8.5% of their income on health insurance. It was a golden era, even if we didn't realize it. Suddenly, subsidies flooded the market. People who used to pay $400 a month were paying $10. People who used to pay $1,200 were paying $300. It felt manageable. It felt like the system was finally working for the middle class, not just the very poor or the very rich. But here is the catch, and there is always a catch in Washington. Those subsidies were never permanent. They were written in invisible ink. They had an expiration date, December 31st, 2025. For the last 2 years, politicians have been playing a game of chicken. Democrats said, we have to make these permanent or people will suffer. Republicans said, this is too expensive. We can't subsidize this forever. And while they argued in committee rooms and on cable news, the clock kept ticking. Tick, tick, tick. And then the ball dropped. Happy New Year, 2026. Congress went to recess. The bill wasn't signed. The extension didn't happen. And just like that, the training wheels were ripped off the bike while you were riding 60 miles per hour. The cliff isn't a metaphor. It's a mathematical reality. If you earn $52,000 a year, yesterday you were protected. Today, you are exposed to the full, brutal force of the American medical market. Let's stop talking in abstract terms. Let's look at the receipt, because the math is what makes this terrifying. I want to introduce you to a profile based on the average listener of this show. Let's call her Sarah. Sarah is 45 years old. She lives in North Carolina. She's a graphic designer, self-employed. She makes about $60,000 a year. Not rich, but comfortable. She pays her taxes. In 2025, thanks to those enhanced subsidies, Sarah's benchmark silver plan cost her about $280 a month. It was a stretch, but she could do it. That's roughly $3,300 a year. January 1st, 2026 hits. The subsidies vanish. Sarah opens that envelope we talked about. Her new premium? It is not $280. It is $850 per month. That is $10,200 a year. That is nearly 20% of her pre-tax income gone, just for the privilege of having a card in her wallet that says she has insurance. That doesn't even count the deductible she has to pay if she actually gets sick. Now, multiply Sarah by 3 million. That is the estimated number of Americans who are currently in the subsidy gap. These aren't the poorest Americans. Medicaid still covers them. These aren't the wealthy. They can absorb the cost. This is the squeezed middle. The freelancers, the small business owners, the contractors, the early retirees. And here creates the psychology of the death spiral. When Sarah sees that $850 bill, what does she do? She is healthy. She runs. She eats kale. She hasn't been to a hospital in 5 years. She looks at the $850. She looks at her rent. She looks at her grocery bill, which is already up 15% due to inflation. She makes a choice, a rational, dangerous choice. She cancels the plan. She decides to go bare, to risk it. I'll just be careful, she says. I won't get sick this year. But if Sarah drops out and millions like her drop out, who is left in the insurance pool? Only the sick people. Only the people who know they need expensive care. And when only sick people are insured, the insurance companies panic. They raise prices even higher to cover the costs, which forces more people like Sarah to drop out. Round and round it goes, the death spiral. And you are trapped right in the middle of it.
So why did they let the clock run out? Why did 535 people in Washington, D.C. decided that Sarah and millions like her should suddenly lose $6,000 a year? If you turn on the news, you will hear a very specific phrase repeated over and over again. Maybe you've heard it. It sounds like this: fiscal responsibility. Critics of the subsidies argued that the government was spending too much money. They said that by subsidizing insurance for the middle class, we were distorting the market. They said it cost the taxpayers $30 billion a year to keep these premiums low. $30 billion. It sounds like a massive number, doesn't it? But let's put that number in context, because in Washington, context is the first casualty of war. The U.S. military budget is nearly $900 billion a year. We spend billions on foreign aid. We spend billions on corporate tax breaks. But when it came to keeping Sarah's health insurance affordable, when it came to ensuring that a freelancer doesn't go bankrupt because of a broken leg, suddenly the wallet was empty. It wasn't an accident. It was a choice. It is easy to cut healthcare for the self-employed because the self-employed don't have a giant lobbyist group sitting on K Street. You don't have a union. You don't have a PAC. You just have a bill that arrives once a month. And here is the darkest part. Many politicians are betting that you won't notice who to blame. Republicans blame Democrats. Democrats blame Republicans. And while they point fingers at each other on Twitter, your auto pay just drafted $850 out of your checking account.
But the politicians are only half the story. There is another player at the table: the house, the casino, the insurance companies. While you are staring at that doubled premium, asking how you're going to pay for groceries, let's look at the earnings reports of the major health insurers for the last quarter of 2025. United Health, Cigna, Elevance. Are they hurting? Are they suffering from inflation? Record profits, billions in stock buybacks, CEO bonuses that could fund a small country. The system is designed so that even when subsidies get cut, they don't lose, you lose. In fact, they anticipated this. They priced their 2026 plans knowing this cliff was coming. And if you want to get really angry, look across the border. Look at Canada. Look at the UK. Look at Germany. If a citizen in London gets a bill for $850 a month just to have access to a doctor, there would be riots in the street. In most developed nations, the idea of a healthcare cliff doesn't exist because healthcare isn't treated as a luxury product like a designer handbag. It's treated as a utility, like water, like electricity. But here, we have accepted a reality where your physical survival is tied to the whims of a legislative calendar.
So, that's the bad news. The government failed you. The corporations are squeezing you. It feels hopeless. It feels like you should just cancel the plan and pray. But wait. Before you cancel, before you throw that letter in the trash, there is something the insurance companies are hoping you don't notice. A loophole, a strategy, a way to fight back. It's called silver loading. I know, it sounds boring, but boring is where the money is hidden. Here's how it works.
The government calculates your subsidy based on the price of the second lowest cost silver plan. When the silver plan gets expensive, your subsidy gets bigger. But here's the magic trick. You can apply that big fat subsidy to any plan, not just silver. So, if you take that massive subsidy and apply it to a gold plan, something incredible happens. In many counties across America right now, in 2026, a gold plan, which has lower deductibles and better coverage, is actually cheaper than a silver plan. Most people don't know this. They just let their plan auto-renew. If you were on a silver plan in 2025 and you let it auto-renew into 2026, you might be paying the inflated price without getting the full benefit of the switch.
So here is your action plan, right now. Step 1. Log into healthcare.gov immediately. The expiration of subsidies triggered a special enrollment period. You can still switch. Step 2. Update your income estimation. Be accurate. Step 3. Look for the net premium of the gold tier. Ignore the names. Look at the math. You might be able to upgrade your coverage and lower your bill at the same time. The insurance companies bank on your apathy. They bank on you being too tired to shop around. Prove them wrong. In 2026, every single dollar that stays in your pocket is a victory against a system designed to extract it. Be your own advocate. Make the call. And if this saved you even $1, hit that subscribe button. Because next week, we're going to talk about the other cliff coming for the housing market. And trust me, you don't want to face that one unprepared. Stay safe, stay covered.